打球受伤送急诊，缝了4针，费用总额是6052块台币，健保支付5672块，所以只付了380块台币。
This episode is sponsored by Vagheggi.
Healthcare provided by government in Russia are free, but you can pay there for some services, some more expensive medicine. In private hospital, you don't have a line. It's much more easier to get some ticket and make a time when you are coming there. Doctor will listen you more carefully and really care about your health. Salary in Russia for doctors, it's around 18 or 20,000 NT. For a nurse, around 10,000.
When I was in the UK, I had 2 different options when I was sick. I could go to the NHS, the National Health Service, or private healthcare. The NHS is completely free, but the downside of it is that there is a long waiting line. On the other hand, private healthcare is very convenient, but ridiculously expensive. One time I had a really bad toothache and went to see a private dentist. I paid £80 for a checkup and an X-ray. And they told me that I needed a wisdom tooth removed and that it would cost me £220 per tooth. So long story short, I had it removed in Indonesia, which costed me the equivalent of £11.
So a few months ago, I came down with bronchitis here in Taiwan. I didn't know how much I was expected to pay since I wasn't insured at the time, but I ended up paying only about 800 NTD for the visit and all of the medication. I was really impressed with how efficient it is here to go see a doctor in Taiwan. I can get my medicine and see a doctor in the same place. In North Carolina, it's more of a hassle because I need to visit multiple places to get one thing done. I go to the clinic first because it's cheaper than a hospital. Then I need to drive to a separate location to a pharmacy and pay a completely separate bill for my medication. With my bronchitis will cost about $120 US with insurance. In general, Americans pay about $50 to $70 US a month on insurance, and people still avoid going to clinics and hospitals because it's still expensive and you still have costs to pay even when you do have insurance. I pay because it's sort of a safety net, because I know if I'm not insured, I'll end up paying at least 10 times more on costs. The cost of using an ambulance could be anywhere from a few $100s having insurance to over $1,000 being uninsured, while visiting the ER will cost on average about $2,000 US. And the cost of using an air ambulance would cost you over $10,000 US. Share your most expensive medical stories down below, and don't forget to subscribe for more videos.